I am Dr. Sandra Rizaldi, and I'm also known as Dr. Sandy. I am the founder and CEO of Nurses Against Violence Unite, which was created in October 2017. So, what it is a nonprofit targeted solely on the hearts of nursing professionals. It's solely the heart of nursing. And what we do is we provide a safe place where nurses and healthcare professionals can come and express themselves without judgment or criticism. More importantly, to be a friend and to build relationships. This is vital as we work with so many patients and their families that are having all kinds of emotions and they're suffering. It is important for us to be able to work with these kind of individuals and to be able to have a place to go. So a lot of the times when people are suffering from emotions, they act out or they we've had a lot of patients that bite, spit, punch, kick, and even nurses have been killed from patients. So I felt it was very important that we needed to touch on this kind of a subject because of the fact that there's just so much of it going on. So, you know what? I've got all these papers and like I made all kinds of notes, but I fly by the seat of my pants. So I'm just going to do this. I'm going to put them aside and I'm going to talk to you about what is happening in nursing. So, how Nurses Against Violence Unite started was basically from my DNP project because of the fact of I lost my clinical rotation site. We were about to start a system wide, as far as like throughout the whole hospital. We were going to be starting a anonymous reporting system, which was what with a ballot. And when I did it just with this one unit in 1 week, I got one ballot. I think it was verbal violence, and then the next week it was 900. It jumped 900%. So we were going to implement this to all the other different units. And what ended up happening was when we were gearing up, and it was the day before, I got a call from my preceptor saying that I was let go from my clinical site. Now, to back up a little bit, I had been chosen and with honor to serve on the American Nurses Association panel for end nurse abuse. And what it was a bunch of us minds got together and we put in our input of what we were working on or what we knew about the violence in nursing. Now, this coincidentally was happening during this rotation where I was looking into reporting problems. Now, seeing that there was so much over the time that I have been in the nursing field, seeing it growing up and seeing how bad it's gotten, the reporting was not matching what was actually being shown. Now, I've been in nursing since I was 16 years old, so about 28 and a half years now. And I started out as a nurse's aide, like assistant, and then because I was too young to work on my own. And then I CNA at 19, and I was an ER tech for 4 years before I became a licensed practical nurse while I was going to school. So I was a licensed practical nurse for 4 years, and then I've been an RN since 2010. So, and of course, I've gotten all kinds of education degrees and stuff like that. So, I was working with my preceptor with that, and we did an education program, and I noticed that when we did this, it was the education. My project was to somehow make a yearly retraining, like a brush up training. It's like 4 hours. We had to make it, I wanted to make it like more entertaining and fun. So what we ended up doing was having the participants dress up as patients that, and just be over the top, like their most obnoxious patients. And to see them come in the door when they first got there to being flat affect, being angry, being annoyed, like nobody wants to do the training. I mean, after a while, some trainings get tiring. So, but this is our ER folks coming in, and by the time they left, they were laughing, they were having a great time, and they truly appreciated that experience because they were able to break the monotony. They were able to actually feel like they they learned something. They actually learned more things about themselves that, even if they laughed and even if they did some art therapy, because we had them like drawing and, having fun with coloring and being creative, and they absolutely loved it. And it was such a great experience for me because I was just starting out. I got my master's in nursing education before I got my doctorate. And that was a start for me. And when my preceptor had to figure out other departments that needed this training, she had compiled a list of like maybe like 5 or 6 incidences of these violent code um, reports. It was like maybe like 5 or 6 for each unit, like for over like a 60-day period, I believe. That's not that to me, that's not a lot, but I was wondering why these were just the like administrative reports. It didn't make any sense. When I looked on the reporting platform, only place where I could see where it could go is the miscellaneous file, and it was labeled provision of care. In other words, not exactly. It's kind of like, in a way, it's kind of like, it's a trash bin, really. So when I noticed that, I just so that's like where all the reporting was going to when somebody would file a report. So it was not a place where things were actually being calculated, because obviously what she had versus what was actually with the AOD reports, which is the administrator on duty, that's the only time that things were ever reported. So that was quite, I don't know, but I don't think there's ever on any unit like only 5 episodes in like 30 to 60 days. It doesn't make sense. So especially when this hospital that we were at had a high, and the hospital system that we were at had a high incidence of a lot of like opioid abuse and heroin and stuff like that. We had a lot of addiction coming through and a lot of homeless people, which not every homeless person is addicted, but you understand what I'm saying. So the numbers didn't add up. So it just kind of like, I kept asking the questions, why? So when I put the stuff for my master's together with my DNP project, and when it came to figuring out my title of what I was doing, the nursing indicators were psychiatric, physical abuse, and then there was job satisfaction and turnover. So it was quite interesting for me to I could tie all those together, and bam, it came down to what is happening on the floor is that people are not reporting, as we know, not reporting violent incidences and things that are happening to them because of the fact that, nobody's understanding why people aren't, like, they're not able to staff. Okay. They're not able to staff units because there's a variety of factors. One big one that is more current than not, as staffing has gotten even worse. Why is it getting worse? So, and that was my job. That is something that I felt very passionately about. So when I was let go of my clinical rotation, my heart dropped because all I wanted to do was just help out. Because if nurses don't come to work, then, and you have to constantly rehire new nurses because of the fact that, either they are out sick or they got hurt or they just want to take an extra day off, or, just a variety of factors. It was it was troubling to me because all I wanted to do was help the staffing issues on top of helping, of course, my nursing community. What was happening? And so when it came to picking my topic, I picked from those 3. And what I found was not a lot of articles. There was really nothing. I scoured the internet. I tried whatever I could to get the information about what I was seeing was not congruent with what was being reported. And then I started coming across, I came across maybe 2 articles. And then it just started escalating, and I started digging even more down different avenues, because that's exactly how I had to go in order to be able to make a point with my project. Now, my department chair wanted me to do a systematic literature review. Obviously, I did not have enough information to do that. So what it is a systematic literature review is a bunch of different documents, like articles that you compile together, and then you say, well, maybe this is a good recommendation. I wanted to do a staff project, and that is staff education project, because that was highly important, as I found other things as we get to it. So when I was picking my topic, I decided that I was going to, initially, I was going to talk about patient on nurse abuse. That was what, and then I was going to start with reporting to find out, was it even getting reported and why? And obviously we know that it wasn't getting reported because people are afraid. And as per literature is also stating that nothing's going to get done anyway. So it's just a part of the job. Now, when you take that even farther, it has everything to do with learned helplessness, where it's like you are pretty much conditioned to feel like nothing's going to happen. And no matter what you do or what you say is just the way it's going to be. And it always will be, which conditions the nurse and the nursing professionals to think that what point does it make? I'm not going to say anything. So, and then the retaliation that nurses get when they do report it. So when I came up with that topic and I told my coworker, I said, well, I figured out what my topic is going to be. And she's like, oh, yeah, what is it? I said, patient on nurse abuse. She looked at me and she's like, what? Because she was a seasoned nurse and hadn't been on the floor for like 15 years or something. And I said, yeah. And she's like, well, that's really interesting. I was like, yeah, I think I'm going to get myself into some trouble with this one. I just have that feeling. And then that's when, later on, I lost my clinical rotation. But my intention was not to get in trouble. My intention was only to help my profession, because there's no reason why nurses should be afraid to speak up their mind if something's not safe, because if it's not safe enough for the other patients, right? So it is important that we are advocates. I was taught to be an advocate. I was told to stand on my feet and make sure that people heard me. And that's exactly what I'm doing. And that's why Nurses Against Violence Unite is such a huge thing and is exploding, because we've created this atmosphere of caring. And when you have, and I'm going to put it hopefully in the most simplest way, if you have somebody that's constantly getting negative, right? And that's constantly coming at you, you also have things at home that you're not bringing to work, but yet it's back here, right? You constantly are trying to do the best you can at your job. Your acuity is not matching your ratio, the patient ratio that you have, right? So you might have 5 patients, as you can see in my 9/11 video on Facebook. You'll have 5 patients that turn into 25 patients because they need a higher acuity, right? So you'll have like maybe 2 to 3 people on pain medicine, and they're always programming their phone or whatever. You have to meet with them. You have you might have a hip, a post-surgical hip. You might have somebody that's getting ruled out for MI that is waiting on their last troponin. So you have these patients, and then one cellulitis, maybe somebody that is homeless that just needs to get clearance. There's 5 patients turn into 25 easily. And I'm sure a lot of you guys can definitely agree with me on that one. So what ends up happening is that nurse over a period of time is taking and trying to sustain this amount of work on top of, now we'll say 3 people of those patients are on pain medicine, and they are asking for it every time that it's due, and you're not just giving it to them. That is going to be, we'll use every 2 hours for, like, we'll say the Dilaudid, right? Every 2 hours for Dilaudid, that's 18 times, not including, assessing for pain, giving the medication, and reassessing, right? So that takes up a huge chunk of your time just without even doing assessments. So you are literally, for 12 hours is not even enough time to take care of all these people, right? These 5 people that are actually 25. So how much can one nurse take after taking care of all of those patients? We are so focused on staffing. We're so focused on that problem. How about, why don't we focus on the heart and the heart and the mind of the nurse, right? So if you have this over a sustained period of time, it is shown that it will break down somebody. It will break down that person. They're not eating. They're not getting the basic needs. They're human needs. It is a human right for you to be able to use the bathroom, which more times than not, people don't even remember to go to the bathroom because of the fact that they're running so much. Sometimes they don't even take their lunch break. And if they are taking their lunch break, they're charting or doing something that they're trying to keep up. They're not eating. They're not able to go to the bathroom. They're not drinking anything. They're not remembering to do that because they're slammed and they can't have their water bottle or whatever on their cart. And then they're penalized because if they don't take their break, they're going to get in trouble, right? So there's all kinds of things. And then if you do take your break, oh, it was nice that you got a chance to take your break. I didn't get a chance to take mine. I mean, you get like the side backbiting, you know. You got the lateral violence, people start taking it out on each other, and then you're not supported from the administration because they're down your throat because you're not sustaining whatever needs that they have. And then your patients are indirectly and directly affected because they don't have their nurse able to take care of them, and you're feeling guilty because you want to be able to take care of them, and you have to do all of this charting, which that is why we have the computerized charting that was supposed to be able to give us more time on the floor. It has not done that. It is actually most of the time than not, they are not using good computer programs that are taking the information and filtering it all the way through. So you're not doing redundant paperwork or charting actually. And it just continues. It's just out of control. So that is how I figured out my topic. So patient on nurse violence was number one, and then it spawned into different things. So when I got done with my when I was done with my master's, I decided that I wanted to go into teaching just for a little while. I had been on the floor up until about 2.5 years ago, and so being involved with the community and being able to see the changes and the homelessness that happened after the housing boom, and the mental illness that developed even more so because of the fact that they aren't taking medications, they didn't have insurance. If you made even unemployment of over 12,000, you couldn't even get Medicaid. So, and sometimes more than that, you weren't able to qualify for any kind of assistance. So we have all of these problems of society that have compounded our society over a period of time, and they've become more they've become more vulnerable, we'll just say, both mentally and physically and financially. So, and that compounds over time. So when we have a nurse that's taking care of this kind of community, and not just in one area, this is nationwide and even global. We have a nurse that's taking care of this kind of community without any government, without the hospital, backing them up. What's going to end up happening? That nurse is pretty much left alone. There's no laws to protect any nurse from any kind of physical harm or retaliation from an employer. OSHA only makes recommendations. They are not at all. They're not wanting to step into monitoring healthcare facilities. And that's a fact. You could look on the OSHA website. They just make recommendations. So we're pretty much by ourselves. We have no laws to protect us for when we are retaliated against for reporting. And so what happens to that nurse that feels like they have no place to go? Well, this is why Nurses Against Violence Unite has become such an organization, because it is not fair to this individual. And there's many out there that have no place to go. And if they try to say something to their peers, then they're basically shamed because they can't keep up with the load that they have. And that's not fair. It's not fair at all. And so when it is a known fact, when you have high levels of stress and you are absolutely overwhelmed most of the times than not, it can wear down your body to the point that your genetics start to change. So with high stress, high anxiety, this changes the chemistry of your body. So it's a shame. And then it could trigger illnesses like schizophrenia and bipolar, or something that was like in your body and dormant for years and years and years and generations. And just a certain little things can trigger some kind of a mental illness. We also have a lot of nurses that have turned to drugs and alcohol. Why do they do that? Well, because either they got injured and didn't want to say anything to their employer because of the retaliation issue, or because of the fact that they got hurt and they had to come back early from workman's compensation because it pays 65% of their pay, and they can't sustain a family on that if they're a single parent. And also just everything in general. I'm not giving anybody the right to go and drink and do drugs. Okay. I'm just stating a fact that these are the avenues that people go down because of the fact that they're trying to self-medicate. Okay. So we have a lot of nurses that are in pain and that are hurting. And this is what Nurses Against Violence Unite stands for, is to give everybody a safe place to be able to go and not be judged, and to feel like they count. What they say counts. I know there was a couple other things that I would say. We had our first rally. We are the first nursing organization, nonprofit, that has catered to the heart and minds of nursing professionals. And we have not gotten into the legislative piece, but we are about to get started with that. And just wanted to give you guys, I want to make sure I got everything, but I wanted to welcome everybody to Nurses Against Violence Unite, because we are a community of friends and family. And you know, we're always open to meeting new people. And if you feel like you need to do our anonymous reporting, because I started that, you know, I'm working with Jessica, which is our new president, and we've got a couple other people we're about to announce. And it is going to be one wild ride, and just hang on. If you have a story that you want to share with us, we can keep you anonymous. It is completely your choice. If you would like to do that, please feel free to reach out to any of us. I also want to mention, we have also, so no nurses are left behind, or even nursing students. Everybody is welcome. Nursing students, nurses, nurse practitioners, nurses aides, EMT workers, firefighters, doctors, everybody's welcome on our page. It is the title is because of the fact I lost my, when I lost my clinical rotation, I had a place I can go, right? So now you got a place to go. So again, welcome. And if you feel like you want to share your story, please do. Also, one last thing before I go, we have a mentoring program. It's free. And I also want to make sure that you understand that joining us with Nurses Against Violence Unite is free, because being kind is free. And that's the way we're going to keep it. And if, you know, with education pieces and stuff like that, we might have to charge a little bit, but that's not going to be with Nurses Against Violence. That's going to be with another organization that I've just created. So I just wanted to welcome you again, and feel free to invite all your friends and family, and get the word out, because we have another rally coming up. It's going to be in April 21st and 22nd, and that's in 2020. And thanks. Talk to you soon. Bye.